So we're taking the next steps, leveraging RNAO clinical pathways to become a BPSO. And you will find throughout this presentation that we'll talk about how each really complement each other and talk about the synergy between the two programs. I'd like to start with the land acknowledgement. So we recognize that our work and the work of our members takes place on traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of the RNAO is located on a traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, which is the agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also recognize that the participants of this webinar are located in other traditional lands across Ontario. Today, this land is still the home to many First Nations, Inuit, and Métis peoples from across Turtle Island, and we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back over 10,000 years. We encourage you to learn about the land you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. So today I'm joined by my colleague Julia Fineczko and Tanya Davis, and we'll be speaking regarding the best practice spotlight organization, deliverables, and experiences. So today we're going to do an overview of the RNAO and BPSO program. We're going to talk about the scale and impact of BPSO, BPSO program overview, eligibility, what the application process is and timelines, and at the end we'll have questions and answers. So just a little overview of the Registered Nursing Association of Ontario. So we're the professional association for registered nurses, nurse practitioners, and nursing students in Ontario and Canada. There's over 54,000 individuals who are members of RNAO, and that really makes for a strong, credible voice leading to nursing profession, influence and promote healthy public policy and clinical excellence. And then, of course, we have the best practice guideline and the best practice spotlight organization and knowledge to movement, our signature programs of RNAO. And we also have the health policy program, and that's a core pillar at RNAO. So we advocate for health policy for Ontarians and for Canadians. So the RNAO program, the social movement of science. So what we discovered or we've appreciated throughout the process is that guidelines are wonderful tools. But we didn't want to just make guidelines and have them have shelfitis. So we developed ways in which we can implement, we can disseminate, and how we can evaluate and sustain the changes within. So this is a social movement of science. And so this is an integrated BPG model, and I'm sure that through clinical pathways, you've also seen this model. So we have all the best practice guidelines. We have over 50. And we also have implementation tools. So not only did we want to develop, like I said, these wonderful guidelines, but we wanted to make sure that we gave the tools to you to disseminate and actively support uptake and sustainability. So many of you may be familiar with the long-term care toolkit, of course, the leading change toolkit, and then we have others, primary care and the youth wellness toolkit. So there's many resources to help you implement and sustain the changes that you make. So our program is the Long-Term Care Best Practice Program, and there's 14 of us throughout the province, coaches who work with all the long-term care homes, no matter if they're a BPSO or not. And our program goal is to improve resident care outcomes. And this is through a systematic approach to implementation and sustainability of evidence-based practices. And our program is funded by the Government of Ontario. So we have been in existence for almost 20 years, and we have really enjoyed working with the long-term care sector. Many of us on our team, everyone on our team has worked in long-term care, so we're very familiar with the structure and the nature of long-term care. So best practice spotlight organization, what we're here to talk about today, is the principal goal is to influence uptake and sustainability of best practice guidelines. And it's a partnership between RNAO and organizations to advance practice excellence and optimize person, organization, and health system outcomes. And you'll hear from Janice how BPSO really influences organizations and really assists with the quality of care for residents and healthy work environment. So here is a BPG implementation methodology, and we're looking at the system level, so implementation projects, but then we're looking at the organizational level. And so clinical pathways is a way to embed BPGs regarding documentation. And best practice spotlight organization designation really helps with building the capacity of your staff. So clinical pathways kind of gives you the tools, the practical tools to put in point-click care, but then building that capacity of your frontline staff, really getting them to understand and take an active role in those changes in implementation. So BPSO is a global initiative. We have BPSOs throughout the world, more than 1,500 BPSOs, healthcare organizations, and academic sites. And in Ontario, for long-term care, we have 90 best practice or BPSO, sorry, homes, and we have one BPSO host. And here's a sample of all the BPSOs who are presently in our program. So the BPSO methodology. So like I said, it's a partnership. And what we'd like is the organizations to implement 3 clinical focused BPGs over a 3-year period to attain their BPSO designation. And Julia will touch upon what that looks like when you're involved with clinical pathways. The other thing is we want you to develop an infrastructure. We want that capacity development, and that's really key is how can we get the knowledge to everybody? How can we inform and create an environment that is evidence-based? Obviously, with clinical pathways, you'll have systematic implementation of BPGs, and then monitoring, evaluation, and research, which Enquire will help support, and then dissemination. So you'll have many opportunities to disseminate your learnings and your challenges and your successes. And so once you're designated as a BPSO, then you continue to work on those BPGs, you expand, you spread, and you mentor others. And Julia will get into the details regarding all these aspects. So I'd like to introduce Tanya Davis, my colleague, who's a coach, and she will introduce Janice.
Good morning, folks. Well, thank you for joining us today. I have the distinct pleasure to work with Janice Elder. She's the Director of Care at Glen Hill Strathaven, Durham Christian Homes, and you're located in Bowmanville. I think this is a great time. Anytime I'm looking at something new and integrating a different clinical practice, I always want to know the why. So, good morning, Janice. I'm wondering if you can tell us, why did you decide to join the BPSO movement?
Good morning, everyone. So as Tanya said, I'm Janice Elder. I have a background of 30 years in healthcare, primarily in acute care. So I was actually the newcomer to this team back in 2022, Glen Hill Strathaven, myself and the ADOC, who had been in long-term care in this home specifically for 26 years. We were really coming from a bit of a different perspective, but we joined together as the DOC and ADOC role at the same time. So I was bringing from an acute care background and perspective. I had had previous experience working with BPSO. So our facility had obtained BPSO designation, and we were several years, I would say almost 4 years into the actual post-designation process. There we go. So we had had experience. I had implemented specifically on several of my home care areas, purposeful rounding. So we had addressed, our falls prevention, BPG, and it really had an impact. And so I was bringing with it that success and that, I was really enthusiastic about RNAO and the best practice guidelines and the best practice spotlight organization. And we had decreased our falls rates by 30%. So it really had a positive impact, and it brought that enthusiasm for me that when I heard that we had the opportunity as a long-term care facility to also have a BPSO designation, it was immediate. Yes, and enthusiastic. So
that is amazing. No, that is absolutely amazing to think, you're taking it from an acute care setting, seeing the successes there, and then bringing it into the long-term care sector. So how did you see the impact? Like, what were the impacts for the residents, for the staff, and for the organization?
So when we were first coming together and starting in on our journey, we started with the clinical pathways as well. So I should backtrack a little and tell you that we were an older home. Our documentation was literally still happening on paper, specifically for our PSWs, but a lot for our nurses as well. We didn't have electronic EMR. So we were aligning our clinical pathways at the same time as starting this BPSO journey. So it really did coincide, and they worked well together. It was just a smooth transition. The impact specifically on our team members is that I feel there's been a shift in culture, a shift in ownership with the team. They're engaged, and they feel that the momentum is growing. So as we've implemented each BPG, I feel like their enthusiasm grows. And if anything, I would find at this point, and we're only 2 years into this 3-year journey, we're 2 years in, and I have to tell the team we can't do them all. Because now they're enthusiastic and they want to do, well, let's add oral care, let's add wound care. And so trying to keep the team really to let's just methodically work one and finish and move on. For our residents, I would say it has changed the language that they use as well. Resident family-centered care and person-centered language has really become the norm for both residents and staff, which is exciting. I feel like the resident buy-in has been really evident throughout the home. We recently had an in-person best practice champion training, and the feedback was so positive. We had 2 residents, and then we had a resident family member who participated, and the 2 residents were really, really excited. They felt like they, in fact, in one of the residents' words, he said, "I really feel like I know what's going on." And they felt like they had a place and a role in where the home was going.
Is amazing. That is amazing. So when you're doing all this work and you're seeing such a beautiful change, how are you finding the coaches, and what help are you getting, and how does this help you through your BPSO journey?
So we've had the pleasure of having 2 coaches, and initially we started with Danny, as you know, and now we have Tanya. And from the get-go, both of them have been amazing. They're extremely supportive. They were just so enthusiastic and so excited about the program that it really kind of lit, that initial stages. It really helped support us when we were questioning, if we were a little overwhelmed or we had some questions or we were concerns. They became an extended part of our team. We had a lot of questions. The first couple of months, it felt like we were looking at a lot, but they broke it down for us and kept it simple. They've become like our mentors, our coaches, and they're definitely the people we reach out to continuously. Tanya has become a part of our team now. If we have any questions, related to BPGs in general, she's our go-to person. So it gives us that support. We feel like we've got guidance, but they also allow us to, trial different options. And then they give us, a different lens to look at things, maybe a different perspective when we're implementing new processes.
It's been a pleasure working with your team. And it's nice as a coach, I have designated time just for your team. So it's been a pleasure. And of course, I'm going to be right in having more fun with you guys. So when you look at new homes or homes that might be here today, what are the tips that you would give homes that are contemplating being a BPSO? Because you're already doing the clinical pathways journey and there's a lot of work with that. And now you're thinking about best practice spotlight organization.
So in our experience, what we've found is when you're doing the clinical pathway, you're doing the bulk of the work anyway. You're already doing it. So the BPSO it mirrored along our journey and just matched where we were going for the future anyway. What it's done for us is we feel that not only our staff, but the interdisciplinary team has really gotten involved as well. So if there are teams that are even thinking about it, I would encourage them that it's made such an impact for us in terms of even when we have ministry visits, for example. So I know everybody gets really overwhelmed and they get stressed when you have ministry visits. I feel like we're confident now that we have not only the clinical pathways, but the BPSO work that we've done, that our team, when they're asked questions or when they're looking at our documentation online, they're confident in themselves as well. So it's really had such a positive impact on a lot of areas.
Oh, this is amazing. If there's one major, thought about BPSO, what is your, caveat to why you did it? As in, like right now you go, oh, it's a lot of work. What is your takeaway for other homes?
So the thing that stands out the most for me is it's had a positive impact on resident care. Our resident care outcomes, we're seeing significant improvements. We have not received one single compliance order. We really feel that our team has been focused. The documentation aligns with best practice. Everything that we've worked on has really had just such a positive impact on resident care and their outcomes, as I mentioned. I think the team, something that we've added to it is we've really tried to think sort of outside the box and have fun with things. I mean, I think Tanya knows that we've had, when we had our implementation, for example, we put a one of our resident dogs in the home wore a t-shirt, and we got everybody white sunglasses and told them that the future was bright, and just getting the team involved and having fun. Recently we had a karaoke for the staff, and we talked about BPSO. Then we had karaoke contest and the residents judged it. And so all those little opportunities to have fun and then plug a little BPSO in there as well, really I think has gained the momentum as well.
That culture of change. Your organization is amazing. It's a pleasure to be a coach with you. It's a pleasure to have lots of time to, be a mentor and have resources. I can't thank you enough for coming and speaking with us. And with other homes, I'm sure they're going to have lots of questions here today. Back to you, Sue. Or maybe it's Julia. Thanks again.
Thank you, Janice. I'll take over here. So thank you, Tanya and Janice. It's lovely to hear from you and hear your experience. So my name is Julia Fineczko, and I'm the Associate Director for the Long-Term Care Best Practices Program. And it's so exciting to be with you all this morning. I see some familiar faces and familiar names, so very excited to have you join in on the BPSO movement. So I'm going to go over the eligibility criteria as well as the deliverables for the BPSO Long-Term Care Best Practices Program. And so on the next slide, just wanted to sort of, in an image, represent the synergy and the overlap between the two programs. So recognizing we as an association support both. We have experienced individuals on our team that have worked in long-term care, some of which have worked in homes with clinical pathways. We work very collaboratively with that team, and so always looking for opportunity to streamline, to enhance the programs, and to identify the strengths in doing both simultaneously. And so on the following slide, you'll see that there is synergy between both programs. So first and foremost, it's the implementation of the best practice guidelines, which are created at RNAO and are robust documents in different clinical topic areas. Again, what I heard from Janice this morning, ministry arrivals and visits and inspections. And so our intention along with clinical pathways is really recognizing the strict environment in which long-term care leaders and staff work in and operate, and recognizing the importance of compliance with the Fixing Long-Term Care Act, which aligns also with what evidence-based care is. And so bringing those two together. Our program goal and the goal of BPSO is also to improve resident outcomes, to have efficient staff processes. So again, looking for opportunities where we can enhance practice, enhance policy and procedures, engagement of residents and families. So recognizing, the resident is perhaps the individual we're caring for, but they also come with their family and caregivers and friends. And so recognizing the impact and the role they have on their lives and in the care overall for us as a team. And then the development of an evidence-based culture. So a big movement within the BPSO is this idea that evidence-based care is foundational to all the care that we provide. And really, once you start shifting the culture and the language in your home, it's in the context of BPSO, it's in the context of clinical pathways, but it's also in the context of infection prevention and control and other evidence-based tools that really are robust and really demonstrate best outcomes for residents, our patients, our families, and our staff. And so this is very much the foundation of what BPSO is. And so on the next slide, what we've done is we've really tried to map out comparing the deliverables and expectations of the BPSO program against those that are in clinical pathways. So I do want to recognize that those on the call today, perhaps you've joined the clinical pathways teams program, a few years ago, perhaps you're newer to the program. And so you might be at a different place in your journey. And so when it comes to BPSO infrastructure, I know that this is a requirement for organizations that are in the clinical pathways program. And so again, it's a parallel expectation for the BPSO. And so you'll see that by already having something established, you can build upon it for the BPSO program. When we discuss capacity development and knowledge exchange, so again, for clinical pathways, you have knowledge exchanges and opportunities to come together. For us in the BPSO program, we build upon that, and there's an expectation around having some champions, and I'll speak to that in the coming slides. Systematic implementation of RNAO best practice guidelines. So Sue had spoken to that, as well as Tanya and Janice. So again, it's being very intentional about what you're implementing from those guidelines and implementing it in a comprehensive way. Monitoring, evaluation, and research. So again, many of those deliverables are met and streamlined through the Clinical Pathways Program, but I'll speak to a little bit more detail in the coming slides. And then dissemination. So again, with a vision of sharing your key learnings, your opportunities, the challenges that you had, with the hope that you'll inspire those on the journey alongside you. And so on the next slide here, I'll say that we do have sort of two RFPs out, but this one is intended for long-term care homes in particular that are in the clinical pathways home. And so the eligibility criteria is listed in a little bit more detail within these documents, and this is available on the website. And I'll ask Sitlali to please post the link for everyone that's on the call today. So the request for proposal on the following slide is really for the year of 2026 to 2029. And so it's a 3-year period. And as Sue has mentioned earlier, it's again about that intentional partnership and commitment to work with RNAO to take 3 best practice guidelines and implement them within your organization. And so the RFP that's posted online, it will go into more detail than I will this morning, but it'll outline, again, the requirements, what is expected in terms of the proposals themselves, and more detail around the scoring mechanisms. So when we speak about BPSO long-term care deliverables that are required for this contract, it's really divided into these 5 sections, or sometimes we'll use the words of pillars, sometimes we'll say buckets, sometimes we'll say categories, but essentially it's these 5 main areas. So BPSO infrastructure, capacity development and knowledge exchange, systematic implementation, monitoring, evaluation, research, and dissemination. And so in the coming slides, we'll sort of dissect what does this actually mean for you as an organization considering. And so BPSO infrastructure, so the language in the contract and the language in the RFP is very much about meeting these different deliverables within the BPSO infrastructure. So we found through our many years of experience, and Sue can attest to this because I think she's been there from the very get-go, is there's a huge value in appointing BPSO leads and co-leads for each of the best practice guidelines you're implementing. Alongside of that is really having BPG implementation teams to help move that work further. The intention of it not sitting with one person is because we've recognized that one individual cannot carry the workload required for BPSO. And naturally, people go on vacation, they may change positions. And so it's really important to have somebody that you can delegate to, work collaboratively with, and participate in a meaningful way in terms of that shared learning and experience and workload. Establishing a BPSO steering committee. So this is very much about having something in place that can advocate, promote the program, identify resources that might be needed, or really be in a position to advocate if certain changes are required. Dedicated financial resources. So again, recognizing, the program is free of charge. There is no associated cost with becoming a BPSO other than the protected time of those BPSO leads or representatives to participate in the online events that we have, or perhaps in some of the in-person events that we may have, and the overall overhead and infrastructure required to create documents, to provide education for your teams, and so forth. The last here around ensuring safe storage of BPSO-related documents is very much about having a centralized place for all your information. So historically, what we've come across is, there'll be somebody like Julia in an organization that loves to store everything on her desktop. And then when Julia leaves, so does the desktop and so does all the information. And so very much of value to have something in a centralized place that anyone can access that's on your implementation team and can really help move that work forward if there's any change or need to go back into historical information. And so when we think about BPSO infrastructure, again, building upon some of the work that you've done in the Clinical Pathways program to really continue on that momentum. When we speak about capacity development and knowledge exchange, so again, this is about attending a formal launch with RNAO. So we do have one that takes place in April, and we already have some of the dates set. So this is really a 2-day event. The first one provides an overview of the BPSO deliverables, gets everybody energized, brings everyone together from across the province joining the program, very similar to what you would have experienced in Clinical Pathways. The second day is about an orientation around the champions and developing them as a further mechanism to support capacity development. There's further requirements around having 20% of champions, and I do have a slide for that. Coaching, so again, as you gain experience and momentum in your journey, sharing those experiences with others that are equally joining or alongside of you in the program. Knowledge exchanges and the annual summit and symposium. So we do have monthly calls that our pre-designated organizations do participate in. It's done online. You log on from the comfort of your own home for an hour or so. And then the annual summit and symposium is really intended to, again, bring BPSOs together. And this year, for the first time, we're bringing folks together from across the globe. So really with the intention of energizing and maintaining the momentum of the program. the Clinical Best Practice Guideline Institute. So this is a few days that take place in the year, again, in person, where we speak to the Best Practice Guideline Program, change agents, change initiatives, and really sharing some key learnings. And then the Advanced Clinical Practice Fellowship. So when I speak to the champions, this is a requirement in BPSO that perhaps might be newer to you as Clinical Pathways Home. And so this is about creating a critical mass of team members in your organization to help move forward the change initiatives to really shape the culture around evidence-based care. And so the critical mass has been defined as 20%. And really the whole vision and philosophy of this is that BPSO doesn't start with top leadership. It could start with your frontline clinical teams and really building that momentum and capacity of individuals that are the closest to the work and most intimate with it to make change that is meaningful and important for residents. And so our coaches physically go out into your homes. They provide this education. You can also attain it online through an e-learn. But really what we found is when our coaches show up, there's this energy, there's a momentum, there's always great food to be had. And it really gives an opportunity for the teams to come together and learn from each other, their respective roles, as well as how they collaborate together. On the next slide, again, I spoke a little bit about capacity development and knowledge exchanges. So in addition to attending online knowledge exchanges, our coaches do physically go out to your home. So we do encourage regular meetings as you gain your momentum in the program. Our coaches can pull back, of course, or come even more depending on what your need is. But really, it's about being with you shoulder to shoulder as you do the different deliverables, as you work through the different work plans, and really making transition take place within your organization. And then as I shared mentorship, so you sharing your own experiences with other BPSOs, again, within the long-term care side, but also more broadly across Ontario and internationally, because there is key learnings to be had. On the next slide here, we just wanted to include a few photos from our most recent event. So we had our annual BPSO Knowledge Exchange Symposium take place in November. I say that's recent because it still feels quite close, but appreciating its fall again. And then our annual Clinical Best Practice Guideline Institute, which just finished up here following the AGM. And so again, what you'll see in these photos is a momentum of energy, is an excitement, is leaders, interprofessional team members from across the long-term care sector coming together to really move the needle forward when it comes to resident care in Ontario. This next slide, again, this is a requirement for BPSO. So this is about the Advanced Clinical Practice Fellowship. So again, organizations are expected to submit a proposal. This is guaranteed time and financial resources, $15,000 that can be awarded to organizations that have identified an RN, a nurse practitioner, or a team that is interested in moving the needle forward when it comes to clinical excellence and best practice guidelines. And so happy to give you more information as to sort of what this process looks like when the time comes. But again, it's an opportunity to build on the momentum, to have some protected time for a project, and to be compensated from a financial perspective, because as I shared, it's about $15,000 that can go towards a project or initiative that your organization is interested in pursuing, where the guidelines and the evidence gets to move forward. So the next sort of bucket or pillar or category in the I want to say guideline, but it's a contract that comes to light is the systematic implementation of RNAO BPGs. And so I would hope that these frameworks are familiar to you. I know the Clinical Pathways team, I've had the privilege of being at several of their energetic launches. I know they speak very often about these two frameworks. So again, the one on the left is the Social Movement Action Framework. So recognizing that you alone cannot make change. It's about the team coming together. It's about getting everybody energized, about having buy-in from your team members to really move the needle forward when it comes to projects, initiatives, and best practice guidelines. And then on the right-hand side is that framework that we quite often follow. I know when my colleague Jen does her Champions Workshop, she'll often say, like, this is the recipe book. And so in the middle, that knowledge creation is the best practice guidelines. And again, similar to what you've done in Clinical Pathways, it's moving along that journey in terms of taking the guideline, looking at those recommendations, and giving them some footing within your organization, depending on the need. So in the next slide here, when it comes to the contractual agreement, it's really organizations that are joining BPSO are signing up to implement 3 best practice guidelines, minimally in that 3-year pre-designate period. And so transitions in care and services is a mandatory guideline, which perhaps I'm sure you've heard of in clinical pathways. This is one that was created a few years back with a vision of, long-term care as part of OHTs, as part of a larger system of care. And so how do we safely have residents move between organizations and care providers? The next is people-centered care, which we've intentionally used that language here, but this you might know as RFCC, or resident and family-centered care. So again, this is a mandatory guideline at RNAO. And then a clinical guideline of your BPSO choice. So I'll tell you a little bit about how to be strategic about that in the coming slides. But again, thinking of those 52 guidelines that we have available. And so as a clinical pathways home, whichever guideline you're implementing as part of the clinical pathways, you can use towards this as one of the 3 BPGs for implementation. Next, again, with each of these guidelines, you're going to go through that motion of, coming together as an interprofessional care team, doing an opportunity analysis or a gap analysis to determine where there's a difference between what the evidence is saying and what the realities are of your practice and your organization. From there, you're going to do an action plan and then also do comprehensive implementation so that for every unmet or partially met recommendation or good practice statement, you're actually going to think about, well, how do I narrow this gap? How do I make this better for the residents and the families and the care team? So on the next slide here, I wanted to kind of provide a couple examples that Sue and I and the team have sort of thought of. And again, recognizing you're all at different points in your journey. So some have just joined Clinical Pathways, some are very familiar with that program. And so, for example, if you're an organization where Clinical Pathways has, you're new to that journey, for the BPSO, we would recommend that you would select transitions in care as one of the guidelines. Again, because person and family-centered care is a foundational guideline, so you would select that, and that's a mandatory one as your second. And then you would pick an upcoming a clinical pathway module as part of your BPG implementation. So if you're just starting, we would recommend that you, for example, pick delirium, or you pick falls or pain. Again, whatever falls in the natural category in terms of clinical pathways implementation. If you're in scenario 2, so you've been doing clinical pathways for a few years now, again, as part of those 3 required BPGs, we suggest that you select transitions in care because this is a mandatory one. And again, any of the 2 clinical pathway modules that might be coming up for you. So if you're a little bit later in the journey, perhaps this might be continence or palliative or end of life care. So really being intentional and strategic about determining when are you going to be implementing the clinical pathways and which of those can align during that designate period with the pre-designate period, with the BPSO movement. And so on the next slide, I've been able to connect with my clinical pathways team. And so recognizing that you might have seen this slide. And so this is what I mean in terms of intentionality and aligning your best practice guidelines with where your natural grouping falls for clinical pathways implementation. I will share with you that this is an earlier slide and it's intended really as a placeholder. And I know there's been some shifts depending on what cohort you're in. So again, follow what the clinical pathways team is telling you to do in terms of implementation and the flow and progression. But really, again, thinking about where you fall in relation to these groupings and thinking about, well, what am I going to do in the next 3 years that can naturally align and mirror in the BPSO work? So on the next slide, I want to speak to the 4th bucket, which is monitoring, evaluation, and research. And so again, there's a few requirements required under this category. So we do have a BPSO hub whereby organizations must submit narrative reports online. So this is a new system that we've put in place. Organizations are required, either the lead, the co-lead, or the team to come together to identify, the work that they've done. It's an opportunity for reflection. And to share your journey with us here at RNAO. And so this is done twice a year. And again, there's a vision and hope that you're also sharing what you've entered into that system alongside with your implementation teams, perhaps your board of directors, your senior leaders within your organization, again, sharing the accomplishments and the journey that you've already taken part in. Second to that is the report review meetings, which occur again twice a year with your coaching team. Myself and Sue Sweeney join in on that meeting. And it's an opportunity just to kind of sit back and say, wow, like look at what you've done. Look how far you've come on your journey. Share with us your experiences. Share with us where you were challenged or where we can even do better in terms of our leadership on the program to ensure you have a seamless, satisfied approach with implementing guidelines and with the BPSO program. And so again, the intention is that we meet online in a virtual space and really have a conversation as to how things are going. Next, in follow-up to that as well is Enquire. So I know this is, second nature to all of the team members here in the Clinical Pathways Program. In terms of Enquire, so this is our data repository here at RNAO. I know as part of the Clinical Pathways Program, you're already submitting clinically based indicators, both process and outcome indicators. In BPSO, we have a little bit more of expectation around submitting some uptake and sustainability indicators, which is intended to demonstrate like the spread of BPGs within your organization. So how many champions do you have? How many policies have changed or been impacted by BPG implementation? And then HR indicators looking at, your model of care and staffing consistency within your organization. And so I'll say when it comes to Enquire, a big portion of it is already completed through the Clinical Pathways automated process in point-click care, but there is some additional work and our coaches are more than happy to work with you to help you collect the uptake and sustainability and HR related indicators and to clarify expectations. The next is an RNAO site visit. So again, in that 3-year period, we're hoping, and we'd love to see you more than just once that year, is that Sue, myself, and your coach come to your organization. We look at how things are going, have an opportunity to meet with the residents, your staff, to get a sense of, what does BPSO feel like in your organization? So you've written about it, we've met about it online, but what's that sense of energy when we walk into the building? And really an opportunity for us to connect with your team members as well. And so this is a requirement as part of the designation process, so ahead of when you graduate, which happens at the annual general meeting. And so that's a big celebratory opportunity for you. We often have lots of ministers there. If you know Doris, she knows everybody. So really a great opportunity to celebrate the success that you've done. But again, ahead of that event, us coming on site and having a visit with you. The next is around program evaluation and research. So again, encouraging you to help us further define the requirements of BPSO, to further refine the program, and to participate in any research-related activities that RNAO is considering pursuing that might be a natural synergy or opportunity for you to also participate in. The last section here is around dissemination. So again, to do excellent work in isolation would be a big miss. And so really this is about spreading your excitement, your energy, the great work that you're doing with organizations that are in BPSO, with organizations that haven't considered BPSO, and more broadly across long-term care nationally and then internationally. And so there's a few requirements here. One is around external dissemination. So choosing any of the 3 top bullets over the 3 years. So perhaps you're presenting at a conference. I know OLTCA, for example, or Advantage puts on conferences for long-term care leaders. So that might be an opportunity. Presenting at RNAO events. So our symposium, our clinical institute, at a clinical pathways launch, for example, sometimes they're inviting BPSOs to participate in those events as well. Publishing an impact story, so that could be on our website. Publishing an evidence booster, so working with our Enquire team to really look at the data you've put into the system to be able to succinctly tell a story of success for your organization. And then participating in an RNAO committee. So when we speak about those best practice guidelines, again, we don't create them in isolation. We bring together the experts, but we also involve external partners in the review process. So that might be something that you're interested. Let's say you have a passion in falls and that's a guideline we're reviewing. That might be an area where you can contribute as a clinician, as an LTC expert, and as an organization in the Clinical Pathways and BPSO program. The next is a BPSO launch. So this is a launch that happens internally within your organization, oftentimes occurring within the first year that you join. So you would come to meet with us at RNAO, and determine a location, but oftentimes it happens in Toronto. We have our big launch, but from there you would have your own launch that takes place within your organization. Your coach would be present. I'd be happy to join Sue Sweeney. We very much like to be available for these events. And really this is about getting the team excited in participating in this project, and recognizing again the impact and value of BPSO as a program within their organization and for the care of their residents, families, and the staff overall. The next required activity here is to submit a manuscript. So this could be in a long-term care magazine, for example, or a peer-reviewed journal. And our coaches, they have knowledge, they have skill. We also have a big guideline development team behind us that are happy to help and move this work forward with you and work in collaboration. Web page creation and maintenance. So again, for those that have a website, updating your website to reflect that you're part of the BPSO program, and that you're on this journey, or that you've successfully met designation and the criteria behind that. Social media engagement. So again, the energy is great in person, but social media also gives us an opportunity to spread the good news about what's happening in long-term care across the province, but more globally, because anybody can access social media for the most part. And then public visibility. So again, it's about that energy, that momentum within your organization, with your interactions with your peers in long-term care and the community more broadly. And so oftentimes you'll see, there's an energy behind the BPSO movement, and we have a couple photos on a few slides here to show you what that looks like. So with BPSO, we often talk about this idea of collective identity and BPSO footprint. So if you just pull back and think about, wow, 1,500 organizations internationally, right? This is a collective movement. This isn't just Toronto. This isn't just Ontario. This isn't just Canada. It's all around the world. And so this idea of BPSO and this and what we wear and how we dress, and sort of our conversation is very much about, having that collective identity, having that public visibility, and recognizing that BPSO is about evidence care. It's about best practice guidelines. It's about improving the care for our residents, and engagement, and families and staff as well. And so this is what that collective identity and that social movement is about, from top leadership to frontline clinical team members, residents, families, volunteers, community partners. And so we really kind of wanted to point out three kind of main ideas here, which is that idea of active participation. So again, BPSO doesn't just sit with top leadership, but this is about, getting your maintenance team members in, getting your volunteers involved, the recreation team, nursing department, everyone in between. Motivational engagement. So really tapping on, where is these people's strength? Perhaps you have individuals that are great communicators. Perhaps you have individuals that, like to get things excited. So involving them as part of your best practice guideline and BPSO teams to help move that needle forward. And then a collective culture. So we've been very intentional about, demonstrating here photos where when you walk into the organizations, not only does it have an energy around BPSO, but it also has visible signage that it is part of BPSO, the same way one would walk in with accreditation, right? And so here's a few examples from organizations that are actually in both clinical pathways and BPSO programs that have had launches and events. I know one here is a launch of Glen Hill, actually. So perfect timing. We also have visits to other organizations here whereby we're participating with residents, having meaningful discussion and thinking about, BPSO as a global movement and evidence-based care for our residents. And so on the next slide, in terms of BPSO RNAO program supports, really just wanted to highlight a couple things here for you. So the dedicated BPSO coach that each of you will have as you join in on this program, our intentional orientation that happens in April. Again, it's a 2-day event. That champion development and capacity building, which is very much about developing those champions that can move the needle forward in terms of evidence-based care and best practice guidelines. Our knowledge exchanges, support and training for monitoring and evaluation, the research opportunities for you to also showcase internally and externally at conferences, international conferences. And again, just a big shout out that all of this is free of charge. So there is no cost associated to you as an organization that is interested in joining the BPSO movement. And so I'll pass it over to Sue, who will go over the application process and related timelines, and then we'll open it up for any questions.
Thanks, Julia. So as you can, there's quite a few information that we're giving you, so please don't hesitate to reach out to us, but I'll talk about the application process and related timelines. And I just want to reiterate that this webinar was specifically focused on long-term care homes that are in clinical pathways. On August 19th, we had a general webinar that will be posted probably by the end of this week for sure on our website that you can also look at, and that's for any organization in Ontario, long-term care, hospital, academic, family health teams, and so forth. So you can look at those, that webinar will be available. And once again, this webinar will also be available probably by the end of next week. So initially, we have the online application is based on the content of our request for proposals. So just to let you know, the request for proposals is the same for everyone, but your application as a clinical pathways long-term care home will be shorter. We appreciate that you're already associated with RNAO, you're already involved in our program, so we're familiar with you. So your application is much shorter than the regular BPSO. So we'll give you access to the submission form after you submit a letter of intent. So what we're asking is that you submit a letter of intention if you're considering becoming part of the BPSO program. I will tell you that if you fill in a letter of intent or submit a letter of intent to the online form, this is non-binding. So if something changes, we understand long-term care and sometimes things come up. And if you find that really 2026, the capacity to start BPSO isn't there, or there's a change in leadership, that's okay. You can let us know. But that letter of intent, what it does do is give you access. Lolly Singh, our right-hand man there, a right-hand woman, she will give you access to the application form. So you can look at the application form and fill it out. And then there is online submission with word limits and specific questions. And once again, you do have the shortened version of this since you're already associated with RNAO through clinical pathways. So for the review process, we have a review committee, and also the letters of intent kind of gives us an idea of how many reviewers we need. We usually have 4 to 5 reviewers. Julia and I review all of them, but our coaches volunteer and also review. And then we'll contact successful applicants, usually it's me, and I'll let you know if there's items that we want to expand or really didn't understand. And then you will be notified in February if you were a successful applicant, and you will receive that in writing. So each proposal is evaluated, and these criteria and the scoring is on the RFP. So scope of work is 20%, organizational support is 25%, previous experience is 15%, BPSO's team's knowledge and skill and experience 15%, capacity to deliver the deliverables 10%, and financial contribution 15%. And within the application, there is, and the RFP, there is a sample budget. So when we're talking about financial contribution, that will outline exactly, much of it is in kind. So covering people's time when they go to a champions workshop, or covering when they take time to do BPSO work and so forth. So here are important dates. Once again, letter of intent is due as of October 6th. You could submit it. There is, as you can see at the bottom of the sheet, and it will be found on the BPSO long-term care site, and you can just submit your name and the name of your organization. Online application is going to open October 7th, so that's when you'll get the email from Sitlali saying, here you go, here's the access to the application. And we're requesting a full proposal deadline be November 24th by 4 p.m. Once again, we really try to stick to these, but please reach out if you have any questions, and then you'll be notified of your results in February. So all questions and inquiries you can put in writing as November 18th, and you could submit them to Sitlali Singh, once again, in the attention of Julia. And I just want to point out that this work is funded by the Government of Ontario, and they are our funding source. So Julia had talked about this. We're having a global summit, September 23rd to 25th in Toronto. You are all invited to attend. You can attend virtually. If you're interested to attend in person, please reach out to your coach or reach out to Sitlali. But we'll be talking about globally the BPSO movement and how it has impacted organizations throughout the world in Ontario. So it should be a great, as Janet Chi says, extravaganza. It'll be really exciting. And once again, that energy of collective identity and all really focus on quality of care, healthy work environment. So please, if you're interested or have the opportunity, please join us virtually. That would be great.